Hello again. Welcome to the second episode of our Greek mission. We are on the island of Alonissos, which is well known among homeopaths who come here to study classical homeopathy to International Academy of Classical Homeopathy. The academy was founded 20 years ago by Professor Jorgos KAVOURAS, who is the main teacher. Today we asked one of its lecturers, Professor Jorgos KAVOURAS, a Germany-based homeopath, for an interview. His answers and ideas about homeopathy were very, very interesting. So let's watch it together now.
It's a very interesting question because my journey was quite long to end here where I am now. I started as a civil engineer. I was studying a kind of mechanic science, but after some time I found out that it was boring. I didn't like it too much. But this background brought me on the scientific side of the medical world. I was always interested about the truth and the scientific side of medicine. My first contact with medicine was through naturopathy. I was studying naturopathy for 2 years. And then I found out, and I was disappointed by the naturopaths being not scientific enough for my understanding, and especially many questions were left open. And I wanted to find out more. So I decided to study medicine. So I studied medicine for the usual time. But after the medical study, I had the same. I was a little bit, or not say a little bit, I was much more informed now, but still I did not understand the connections between the diseases. Then I went to a hospital. I had a very good clinical education in a small hospital, and this was very good practical training. And then I opened my own clinic back in 1988. So starting the clinic, I was first doing the conventional medicine, almost 100%, but I found out after some years that the results, although I was very engaged, very passionate, I was very well trained, the results were not the results I wanted to see. People were not getting healthy. They were getting better and worse and better and worse, but finally they were more sick than in the beginning of the treatment. And this was very frustrating for me. And I believe, and I say this to laymen as to physicians as well, that one reason why physicians are frustrated from their work, this is one of the main reasons, because they rarely see really good cures that last for a long time. They have some good results, yes, some of them have very good results, but many times when we're going to speak about this, I think in the interview, we will explain why the results are only for a certain time. So in my clinic, I came into contact, I had become into contact with naturopathy in my early years, and also with homeopathy. So I decided, when my first child was born in 1990, to learn homeopathy more in order not to feed my child with antibiotics. And so I started myself to study homeopathy on a low level. And then I also applied some other methods which I have written a book about, but it's not the subject today, is homeopathy. With the years, I wanted to learn homeopathy deeper, so I went to a college in Germany. I went to the college, but I was not totally satisfied again there. At the same time, a little bit later, I met Jorgos KAVOURAS, Professor KAVOURAS, for the first time, and I found out by his explanations of medicine that this was the first explanation that really made me happy, that really satisfied my need for understanding. Because as a physician, as you understand, I want to understand diseases, not just treat diseases. I want to understand why somebody became sick and what is the best way to cure him. So when I was there at this college, I made the diploma in the college, and once I had made the diploma in the college, I applied there as a teacher. I said, I asked my teacher, I want to be teacher in this school, and he said, yes, you're always putting strange questions, maybe you will be a good teacher also. So I became teacher at that college, already bringing some of the information which I have learned with Jorgos KAVOURAS. And after some years of teaching, it was my honor to teach Jorgos KAVOURAS teaching in London. We founded a school there, and I taught. And of course, by teaching homeopathy, I learned also how to apply better by explaining, and my understanding of medicine became much deeper. So now I'm honored since 2008. I'm teaching at this school, first moderating Jorgos KAVOURAS courses. Now I'm also teaching here, and I believe that this school is the best homeopathic school in the world. It tries to create a very high scientific level, but also a very high level in homeopathy, to make it reproducible and understandable for everybody. So I think homeopathy has, as you said, a long tradition in Germany. Hahnemann was German, and the Germans kept a tradition over all the years, all the 200 years. Of course, where there were periods where they were more active and periods they were less active. At this time, homeopathy is quite well spread in Germany. We have about minimum 7,000 physicians and a lot of heilpraktikers, which are a kind of naturopaths, which they use homeopathy in their daily clinic. And so homeopathy is very well spread. And there's another good in Germany, the assurance companies, like about 80% of them pay homeopathy for everybody. So everybody, almost everybody, 80% of the population in Germany, they can take homeopathy and they don't pay for it. It's a big step, and it makes it, of course, easier for us physicians to treat, because people who have no money, they can go in the system. So what that means is that the assurance companies have learned that by applying homeopathy, maybe they have learned only step number one. The step number one is that it costs much less money. But step number two is that the results are much better. Especially the long-term results, people don't get as sick, or they don't get as chronically sick especially. We're going to talk about this a little bit later. So in Germany, homeopathy is well established, is paid by the assurance companies, yet we have not done the step to bring it to the universities. So this is an addition to the first question. In 2000, I have been teaching in 12 countries, many different countries. I have been trying to spread the idea of homeopathy, holistic medicine, and the idea of integrative medicine to many countries. And since I have a very strong connection to Romania, where I've been teaching for the last 5 years, and we have brought almost 100 physicians. From tomorrow here will be almost 100 Romanian physicians being trained by us. I was awarded with a visiting professor title 2.5 years before. And since 1.5 years I own a title which is Associate Professor for Integrative Medicine and Homeopathy. So I have made personally one big step, but not only for me, for homeopathy. It's very, very important to enter the colleges, because I've been teaching in Germany for 3 years medical students, and I have seen the ease with which they learn this. Their brain is young, they can study the materia medica, about the remedies, which is a lot of work to study. They can study it very much easier. And once you learn the medical students from the beginning, both sides, not only the holistic homeopathic side, but the medical side at the same time, they can integrate it into their brain. And I think this type of physician will be the physician of the future, who is very well trained in classical medicine, at the same time very well trained in integrative medicine and, for example, in homeopathy. So there's another point which has to be addressed, that unfortunately the homeopathic world is not in one opinion. And we have to say that even to laymen, because we may get the impression everybody who calls himself a homeopath can do a perfect job. Maybe, but we try to, here in this school, we try to raise a very high standard for the homeopath, being very well trained medically, has some background medically and also homeopathically, and apply the laws of homeopathy according to what this very wise man, and I'm glad he's on the same picture, I'm honored actually, has taught us, because nowadays there have come so many different schools in homeopathy, especially coming from India. There's a special attraction from the Europeans to Indian culture. That's very good, maybe. But in homeopathy it has brought some problems to us. So in Germany, unfortunately, many of the German teachers, which they started what we call classical homeopathy, without them realizing sometimes, have left a little bit more, and so for the student it's very difficult to understand really what is classical homeopathy if the teacher in front of him has lost the connection to classical homeopathy, because we believe that this is the only homeopathy that can bring results in the vast population, reproducible results, scientifically reproducible results, and this type of homeopathy is the type of the future. I'm sure about this. Of course not. It is, for me, homeopathy is a very scientific method. The background, which comes from Samuel Hahnemann, I believe Samuel Hahnemann was one of the most important scientists in the last 1,000 years. He has a clear scientific mind. He was coherent in his thinking, but it means he built up from his observation a clear theory and a clear practice of homeopathy, which is very down to the earth. Now, that homeopathy, there is no question that if somebody who is on a spiritual path, as many young people are, homeopathy will help these persons to find the truth. Why? Because they will make their mind more clear, they feel better in their life, they feel more fully, they feel more rich, not in money reason, but rich as a person. So they will find spiritual path also means to find sense of your own life. Why I am here in my lifetime. I am here to spread homeopathy, for example. You are here for another reason. But homeopathy, without any doubt, helps the person to find its own way. In such a way it is spiritual, but by its application, by its remedies, by theory, is not spiritual. I understand that in some countries there may be, out of legal reasons, the idea of spirituality, of having an innocent method. But this is not the future of homeopathy. The future of homeopathy is that we manage to bring it in the universities, to make scientific proofs of it, and to slowly convince the conventional medicine that we are doing the right thing. And on this way, integrative medicine, what I practice, plays a very important role because it will bring the two sides together. It will accept the medical side totally. It will integrate both sides into one better medicine for the future. This is a very good question and a difficult question. I always say, because I try to combine, or I try to bring the two parts together, which I think they belong together. There is one main idea in homeopathy, one point which is totally different from the standard medical point of view, and it is the fact that in medicine we believe that if the patient has symptoms, the symptoms have to be eradicated or brought away as quickly as possible. So this is a tradition, and according to this tradition, the patients have been spoiled over the last 100 years by the increasing quality of the chemical drugs, that their complaints go away quickly. Now, we have found out, and even Hahnemann already has found out and stated it very clearly, that the symptoms of a patient are very important for him to get really healthy. That means the symptoms not only are like showing the right direction, they are part already of the cure. That means the first part of the cure, the body always tries to cure himself. In the moment it tries to cure himself, brings out some symptoms. These symptoms are absolutely important for this organism. If it cannot produce symptoms, it's a very weak mechanism. Out of this idea, it's very clear to understand that if you just give a substance to get rid of these symptoms, you may get rid of the symptoms, but at the same time you weaken the defense mechanism which is behind. As to adapt what I said before, the symptom in our belief, and this shows a long tradition we have in the homeopathic culture, is that the symptom is the first attempt of the organism to overcome the disease. That means this symptom is absolutely important and absolutely necessary. So if you treat only the symptom without overcoming the disease as a whole, we call it a suppression. That means this symptom is suppressed. With the result, we have seen this over the last century very much an increasing kind, that patient who, for example, has headaches, and you treat them with painkillers or anti-migraine, specific anti-migraine medicament, then the pain might go away. Now, in a healthy organism will come back. That means the organism is strong. But if it will not come back, this pain, because the pain was to overcome a disease, if the pain will not come back, we start to worry about this organism. Because, most probably, if this pain goes away forever, then the next deeper problem in the patient will be showing itself. We know that everybody of us, we know from research, has a lot of predispositions. So the first predisposition may be migraine headaches. The second one may be asthma. So the person, once you get rid by suppressing the symptoms of headaches, patient goes to asthma, which may be of the same category or maybe even worse. So the patient will suffer much more. But unfortunately in our medical world, these two symptoms are not connected. They think, okay, now first he was a patient for migraine, now he's a patient for asthma. He's sent to a pulmonologist. And now the pulmonologist will treat, according to his knowledge, will give some cortisone, will give some bronchodilators, and the result is, after some months and years, this symptom will be suppressed as well, but the patient is all the time on medication, but will feel okay. If you ask the patient many times really, the patient will say, I don't feel 100% perfect, my energy is a little bit lower, but at least I can breathe. So what happens then? After some years, the next predisposition will be waiting for this patient. So the next thing what will come up may be a depression or some deep kind of anxieties, because this is in the family. The grandmother already had some anxieties, the mother had some depression, now the patient gets the same, which is the result of a suppression, of a chain of suppressions, of first the headaches, then the asthma, and then comes the depression. Now, how we know this? You can tell us whatever you want. No, we have a proof for this. Because if this patient comes to us for depression, and we correctly treat the depression, then these symptoms go away, and the symptoms which have been suppressed before, which was suppressed was the asthma, or some types of spastic bronchitis, comes back. Now we treat this bronchitis, the patient is getting better, but now the migraine headache has to come back. So you see what happens, and unless you treat the migraine headaches unsuppressively, that means curatively, the patient will not be healthy. This we call it continuum of disease. Jorgos, who is the director of this school, he has found out over experience of more than, I think, 200,000 cases that this was happening all the time, that the past complaints were coming back, and once the past complaints were coming back, the patient was doing better. Then the more old complaints are coming back. We cure them, and the patient is healthy again. So this is why we say suppression is not good for the organism. Suppression has brought about that the vast of our population has become more sick. First of all, I also perform classical medicine in my clinic out of mainly two reasons. First, because some of the patients, they want this, and I accept this. Also, many times I combine it. It's not an exclusion. You can treat somebody who's coming from the medical school treatment, and you add some homeopathic treatment. After some time you can leave away some of the chemical drugs. At a certain point maybe he has to take some of them because the disease is very chronic. Maybe he can get rid of the medication, which by the way is very good for our health system because it's a big cost, there's a lot of expenses are for the medication. Now the second reason also is because some patients, they want to have a physician who knows both, who knows the classical medicine as well as the homeopathy. So I try, not only in order to be able to teach my students in the correct way, to keep very close to classical medicine. It's very, very important. Also to advise the patient at the optimum. Because not all diseases can be cured by homeopathy. Because many people come to us when they are too sick. So maybe there is a point of cooperation between the classical medicine, again with homeopathy, again what we call integrative medicine. So your question is what distinguishes classical homeopathy from other approaches. Classical homeopathy first is orientated to what this nice man said 200 years before. Second, it clings to a system which is scientific. That means we have proofs for it. We don't go out of imagination. We don't go out of, as you said, only spiritual reasons. No, we try to keep it simple. We try to keep our teaching simple, and we try to teach things that have are really happening. For example, you have a child and has high fever. You take the symptoms, and because the symptoms point clearly to belladonna, you give belladonna. You don't give belladonna because you think this might be a case of belladonna. No, you need to have the symptoms. And the more solid the case taking is, and the more solid the symptoms are, the more easy it is to prescribe correctly. So there are a vast of new schools, why they are. In my belief is, first, some of the teachers have learned classical homeopathy. This is the better part. Some of them, and this is understandable from a human point of view, they want to bring some specialities of their own inside, and so they change the system a little bit. But if you have a science, this science allows no changes. There is only one law, and if you go a little bit away of the law, your results will be less effective. You go a little bit more, it will be less effective. So what we found out, that this homeopathy, originally found by Samuel Hahnemann, already has everything in it. It does not need anything more. It has the whole possibility of a cure for many, many thousands and millions of people. So again, I have to go back to what Hahnemann says. We have found out, he has stated, and we have found out that it's always the best to give only one remedy. Because, what I said before, we are adapting the remedy according to the symptoms of the patient, as close as it's possible. That means the more it fits to the symptom of the patient, the more clear the patient expresses his symptoms, the more probable is a good cure. That means now, and we know our books say the exact profile of each remedy we are using. So we compare this profile with the profile which is the profile of the patient with the profile of the medicine, and we try to find as much similarities as possible. So this is possible in some case where the patient has a strong immune system, it's easy. When the immune system is compromised, it's more difficult. But now, imagine you add a second remedy into that. You have two remedies which cover different symptoms. And the message for the organism, let's go back to one point. I said before that the symptom is absolutely important for the organism because it's the first attempt of the organism itself to overcome the disease. Now Hahnemann has found out that if you strengthen this symptom, if you make it a little bit bigger, then the organism is ready for a cure. That means it needs a little bit of push. Now, if you identify the pattern and you give one remedy, but instead of giving one remedy, you give another one, you confuse the system. You have a door, you want to open the door, you have one key. You don't put another key inside. What happens actually to the immune system, if you put many remedies together, it will become confused. We have seen cases that have taken 20 remedies, 50 remedies, 100 remedies, without waiting for the action of each remedy, or altogether, which is even worse. And the cases are absolutely desperate, absolutely confused, and even for a master like Jorgos, sometimes it's very difficult to identify the language, to read the language, to understand the language of this organism. Again, this is a very good question. You see, I'm so many years in medicine, since 1976, which is almost 40 years now. I'm dealing on the subject how to help people most effectively. And of course, in the beginning, when people understood that I have to offer a little bit more than the conventional medicine and a little bit even more than this, they came with most serious diseases, cancer, neuromuscular diseases, heavy psychic disorders. And of course in these cases it's difficult to help. But I have found out through the observations of many years that those people who they trust into one method, or maybe combining two methods, have the best results. Those who are combining too many things, I saw invariably that most of them, their health was not re-established. So one possible combination, for example in a cancer patient, is to combine the classical medicine with homeopathy. We have done this many times. It's a very good combination sometimes, because you cannot say, we know it better, we can cure a cancer patient. No, we cannot say this. Many times we can do something. It depends on the level of health of the person. But we have seen very good results for somebody who is, because some of the chemotherapies are successful in a way. So the patient survives, at least survives, and has some kind of life quality back. But sometimes he suffers very much from the side effects. So we have seen that those patients, and I have actually some of these patients, where by combining with homeopathy, the side effects are much lessened. And I believe, going further on in this direction, we can even, and this has been tried in some naturopathic clinics, diminish very much the chemotherapy from the amount. That means less dosage, less time, by combining it. All this is subject of science. And I would call this integrative medicine, which combines these two attempts. Because, you understand, we don't want people to lose trust in classical medicine, although we know that the classical medicine has a problem. Now we want to bring people to combine the good qualities of both sides. Two days before I was teaching in this class, and I was telling the story of a little boy he just had a small handicap. He has an inborn disease, but was normal intelligence. And he was getting sick 5 years before, with a little bit fever and with paralysis of the left side. Could not walk, could not move his arm. And then he was hospitalized, and they did not exactly know what the boy has, but they thought it might become some kind of infection, meningoencephalitis. Then they started treatment. Treatment was with antibiotics first, and interestingly, after applying the antibiotics, the fever raised. The fever was raising, and they give a second antibiotic. Then they make a lumbar puncture. They find some herpes, traces of herpes antibodies. They give an antiviral drug on top of this. With the three substances, the boy was getting worse and worse. His sister, she's a nurse, she knew very well that this boy has not much chance to survive, because the case was going down all the way. Now they tried to make an examination in the MRI to find out exactly what the boy has, and they had to sedate the boy. They give some substance to make him sleep in order to keep still in the examination. And afterwards, when they have taken the chemical out, the boy did not wake up, so he was in a coma. He was the fever was still high, he was in a coma. Now he started to have epileptic fits. start to have epileptic fits, they give one anti-epileptic, they give a second one. So he was already on 5 sub, they give some cortisone also. They give everything what they thought in order to help the boy. They had the best intention, of course. But the boy was going down and down, and finally, desperately, his sister calls a friend, and the friend knew a pediatrician, and he recommended my person. And she called me on a Sunday, and of course these cases are very difficult cases, because you have only a few symptoms and you have to prescribe. Fortunately, I was able to find the correct remedy from the description. I never saw at this time the boy. The boy was in the hospital, and the sister reported me the symptoms. So I decided on a remedy. The boy was given the remedy the next day when they had it from the pharmacy, and from that day on, from that moment on, the boy improved in such a way that next day the fever was down, almost has gone. On the third day, he started moving first his arm and then his feet. On the fifth day, he started to get with help out of the bed and could move. If you would have asked the physician before, they would have said 80% this child will be dead. But if he will survive, he will be in a bad state, like having some residuals, like some paralysis, some mental defect, as we know after a severe type of meningoencephalitis, which was a both-sided. They found out in the MRI later that it was both-sided. But from the very day he took the homeopathic remedy, the boy was getting better. After 6 days he could get in the normal place in the clinic, in the normal, not in the intensive care unit anymore. And after 10 days he was released from hospital. Sensational. And what is even more astonishing is that after all this procedure he was better than before. The parents said he lost some of his fears. He had some kind of light ataxia, which was corrected by the homeopathic remedy. And this is a disease, it's called Nonan syndrome, where the children don't grow. It's a hereditary disease where they don't grow. Now the child, I oversee him for 5 years now. After the hospital, I get to know him. A very nice boy. And from normal intelligence, even now when he came into school, after 2 years of treatment, came into school, he's in a normal class and he belongs to the best of the class. So now another aim I had is to make him optimum length, to make him grow. Now he grows per year 9 centimeters. The last 2 years has been growing 9 centimeters every year. And I think, and we have seen this in many children which had a problem in growing, that what you can do by homeopathy is reach optimum length. You cannot change the chromosomes, no, but you can reach optimum length, and I believe that he might be reaching 1.55 to 1.60, which originally I think they thought the best he can reach is 1.40 to 45. So you see, and this was for me, and I said to my students many times, one case like this is worth for me to study a whole year homeopathy, because it's so satisfying to see the development of such a child. So this is a very good question, and this is the challenge for medicine for the further years. 2 weeks before, I was talking in the Bavarian parliament to some people which are experts for health, and I was explaining them exactly what I'm going to explain now, what has happened in the last 30-40 years. And I need to make a draw for this. This model we call levels of health has been described and found by Jorgos KAVOURAS who is the director of the school, Professor Jorgos, and he found out that it makes a lot of sense that you find a measurement for the level of health of an individual person. So before he comes to treatment, it's good to know where he finds in levels of health. So we have 4 groups of health and 12 levels. Okay? So everybody, each of us, each of the people who are listening to this video, they will find themselves somewhere. So let's say somebody is born in level 3. That is relatively good health. So the group 1 is relatively good health, but because of some stress of the body, this organism goes down a little bit and comes into contact with what we call a type of predisposition. So this is a predisposition this organism has, and the predisposition is dormant. We say it does not materialize at this moment. It's there in the chromosomes, but it's not apparent. So once it crosses that line of predisposition, which may be the predisposition for eczema. It's in English it was eczema. Eczema. Once it crosses this line, the eczema is breaking out of the blue. Nobody was expecting it. So now what I said before, this is a symptom of the organism to overcome the disease first, and always also to prevent a more deep disease, because there might be another line here, down here, which is asthma. Asthma. So, by having this symptom of skin eruption, the organism prevents the asthma. So if you don't appreciate this symptom is an effort of the body to become better, as I said before, the health of this organism invariably will go down. So it will go down and eventually pass the second line of predisposition, which is the asthma. Now the child, maybe the eczema is better, and many times the eczema is better, but now starts to have asthma. And this continues. Behind the asthma there's another predisposition down here of, let's say, mental attention deficit disorder, what we have many times in our children. So once the asthma is not treated correctly, that means we don't respect the symptoms to be a trigger for health, we just suppress the symptoms, someday, sooner or later, the child will be a patient which cannot anymore in the class attend the teaching, will be distracted in what he's thinking, and so on. Everybody knows this disease. Now what I want to say here is, this is an individual case, but if you see what is the development of our population in the last, this is what I was talking to the politicians, since many years I do this, that the whole population in the last 30, 40 years has come down. Let's say when in 1960, 55 years before, the average population in Germany, let's say, was here, finding itself between level 3 and level 4. Now what comes into our clinics is level 6 to level 7. That means in 55 years or even less, we have managed to bring the whole of our population down. And if you think of the idea of predispositions, there are a lot of, everybody of us has a lot of predispositions. If you bring down the level of health of the people, many of them will pass their line of predisposition, and they will be sick. So this is the reason why we're collecting. We are the whole community, due to this suppressively one-sided treatment of the medical tradition, what we do now, is causing a lot of chronic diseases without being intended, of course. They don't know. But I think it's very wise. The time has come, and it's very urgent, because we get more and more chronic people, sick people. The money we spend is a lot of money. It should be enough. But even in the rich countries now, is not enough money. Why? Because the number of chronic diseases are exploding. And the very reason for this is that we are treating our people not correctly. And I ask the medical community to be aware of this, to make studies. I have now, very recently, found a non-profit organization which wants to make a funding for research in integrative medicine. A foundation will come out, a foundation for research in integrative medicine. And whoever listens to this video and has some money, I ask to dedicate some money for this, because the research is very important to show what we can do and how we can prevent that the health of our people is going more down and down and down and down. Thank you very much for this question. So I think we have been discussing the two fractions in medicine. The one which they call, we are the mainstream medicine, at the moment would call it mainstream medicine, and the other one which we call the complementary medicine, which homeopathy is a very important part of it. So these two parts seem to be far apart at the moment, although I have doubts, because I have very good cooperations with many physicians which they use traditional medicine, and I have seen over the last 10 years maybe that they have come much more close. So when I was honored with the professorship for integrative medicine, I found out for myself that this is the way. The way is to bring the two together. That means, and there are concrete plans for that, it's not a vague idea. The next step we're gonna do is that the research is the one which is very, very important. The second one is that we should have some departments in the clinics. That means we show with the patient, we allow the patient to make a choice, but we will integrate the classical side. Patient has all the benefits from there, together with, for example, homeopathy. And we will show by this that we will have better results than by classical medicine alone. They had make, how is it called, a public questioning about how many people in Germany want to be treated alone by the classical medicine, or which want a combination, and was a very clear result, and not only in Germany. In Switzerland has been done also. It's between 60 to 70% of the population. They want a combination from classical medicine and complementary medicine. And this we call integrative medicine. And I believe, out of another reason also, you see, our medicine, coming just from the classical medicine, we see so many disciplines. And the fact is that so many disciplines have spread apart. So one does not know what does the other. Also, this is a task for integrative medicine, to collect them together, to bring them together on one table, to have a patient in the clinic and to discuss together. They have started this in oncology, in the tumor patients. They make this. This is a very good idea. But on this very table, someone who is an expert in integrative medicine should sit at the table and give advice for the benefit and the sake of the patient. This is again a very good question, because most of these people who make these types of statements, they don't know homeopathy. And I will say it in their favor. But if you don't know something, you better shout your mouth. You don't talk. Huh? Because unless you don't know a method with which maybe thousands and millions of people can be helped, by making a statement, you make it more improbable that they will be treated. So, in my idea, it's an ethical crime. It's not ethically correct. But what we have to do is we have to make research. We have to make very founded research, and actually I have started to do 2 studies in Romania, but the problem is that nobody gives us money. Huh? It's very, very difficult to make some research. Okay, I'm not paid in the study, but I have to pay the physicians at least, which they put some extra work. Huh? And we will make very solid research, which will be randomized, double-blinded studies. We will bring in on the highest standard of medical standard, and I'm sure that we can show that homeopathy can do a lot. And so I want in this video to ask all people to support, to find out the truth. Is it correct what I said, or is it nonsense? But it has to be proved scientifically, not by pure statements of people who do not know. Okay, thank you very much.